everyone, this is Dr. Sarah Winward. I'm a naturopathic doctor and a board-certified lactation consultant with your Downtown Doula, and I wanted to talk a little bit today about bottle feeding your baby. So this is something that I get commonly asked, especially with parents who are trying to do some bottle feeding and some feeding from their body. I get a lot of concern about babies being able to go back and forth from your body to the bottle. So I wanted to talk today about a technique called paced bottle feeding. And paced bottle feeding is just a technique that's going to help you slow down the flow of the bottle. And there's a lot of benefits to that, so I wanted to talk a little bit about what those benefits are and how you do it. So the first benefit of paced bottle feeding is that you are, babies generally are less fussy. So because you are slowing down the flow a little bit, you are giving babies time to digest what they're eating. And often, bottle feeding can happen very fast, where it's like, 5 minutes and they're done the bottle. And if they're taking like 2 or 3 ounces in 5 minutes, especially for like a newborn baby, that's a lot of food. And so if they're taking that very fast, they can often end up being quite fussy afterwards. And so paced bottle feeding allows them a little bit more time to digest, and it's a little bit easier on their system. The other thing that's nice about paced bottle feeding is that you are less likely to overfeed your baby. So with paced bottle feeding, you're listening to your baby's cues. They're going to be more able to give you a chance to tell you that they're done, and that way you're less likely to overfeed them, which is good because, again, overfeeding can make babies upset. And then the last thing is that it's going to help your baby go back and forth from your body to the bottle a little bit easier. So the flow of milk from the bottle is quite fast and consistent if you're using a typical bottle feeding technique. Whereas from your body, it's very normal for the flow of milk to ebb and flow. So sometimes there's going to be not a lot of milk or no milk at all, and sometimes there's going to be tons of milk flowing. And it's really normal for it to go up and down like that over the course of a feed. So paced bottle feeding technique is just a technique that's going to help mimic that a little bit more. Helps babies go back and forth between the breast and the bottle a little bit better. So I wanted to talk a little bit today. I have a demo here. So this is just a bottle, this is a very common setup, right? So this is a bottle, like a pumping bottle that you get from the hospital. This is actually just a nipple that I got in a ready to feed formula container of like generic brand, and this is sort of the shape and size of something that you would get in a ready to feed container, which is why I wanted to use this. And I just wanted to show first, if you actually tip this upside down. You tip this upside down, there we go. If you tip it upside down, it flows quite quickly. So you can see that the milk is just dripping out. And so if you are feeding a baby in that typical position that you see people feeding their babies in, where they're laid down like this, that milk is just pouring into their mouth, and that can be quite overwhelming for a baby, because a newborn baby especially doesn't have any way of stopping the flow of milk. Their only option is to continue to swallow it, or else they're going to choke. So that can be quite overwhelming for a baby. However, if I tip it up like this, you can see that it's not dripping out anymore. But if I put a little bit of pressure on there, it comes out quite readily. So one of the key things about paced bottle feeding is actually keeping that bottle in a more horizontal position. So what I generally recommend for people is to hold your baby more sitting upright in your lap. And I like this kind of hold where I'm holding the base of their neck. I've got quite a firm hold on them. Their head isn't going anywhere. You can tip their head back a little bit just because it's easier to swallow with your head tipped back. And so have them sitting upright in your lap like this. And when you go to start feeding, keep the bottle, first of all, tickle the bottle on their lips so that they can show you that they're ready, and then allow them to take the bottle in themselves. So when they're ready, just kind of let them suck the bottle in, and you want to make sure, give them a little bit of pressure behind it so that they're all the way down below, at the very base of it, so their mouth is open wide. And then keep it tipped down so that there is no milk in the nipple of the bottle for 10 to 15 seconds, and allow them to suck with nothing coming. And that is, again, to help slow them down and mimic the flow of your body a little bit more. And then after 10 or 15 seconds, tip it upright so that the nipple of the bottle is about halfway full of milk there. And so they're going to be able to get the milk when it's coming, but it's not being forced into their mouth. And you can just continue to do that. So I usually say about 1 to 2 minutes of more horizontal and then 10 to 15 seconds down, 1 to 2 minutes of more horizontal, 10 to 15 seconds down. Obviously, as you're getting further along in the feed and the bottle is more empty, you'll have to tip it up a little bit more to get that half full nipple. But that's basically the course of the feed. It's totally normal for babies to take breaks. They take breaks at the breast as well, or at your body as well. And so allow them to take those breaks. We have a tendency to, when a baby is taking a break at the bottle, often we'll tip it up or stimulate them in some way to try and get them going. But those breaks are quite normal, and it's part of their body communicating, their brain communicating with their gut to tell them, like, am I more full? I'm not sure, let's see. So allow them to take those breaks, don't force them. And then as they're getting closer and closer to the end of a feed, you'll find that the breaks start to get longer, and they start to get more relaxed, and you can tell that they're done a feed if you try and pull it out and they kind of like, they're not done. Where they're like looking for it, they're not done. But if you're able to pull it out and rest it just on the tip of their mouth there, then they're done, and you can just take the bottle away and they're finished, regardless of how much is left in the bottle. Like I said, it's totally normal for a baby at one time of day to have 1 ounce, and another time of day to have 4. So don't force them to finish what's in the bottle. One of the most common things I get asked about this type of bottle feeding is it going to make my baby gassy? They're sucking in air. Yes, absolutely, it's going to make your baby get more gassy, or at least have more burps, and that's totally fine, totally normal. I generally recommend taking a break every 1 to 2 ounces so that you are burping them, give them the opportunity to burp. They tend to burp quite loud with this bottle feeding technique, but as I said, because you're slowing it down, they're less overwhelmed. They actually tend to be less fussy, even though they burp more. And then the other thing that I tend to recommend as well, especially if you're doing a lot of bottles, is to switch back and forth from one side to another. So do the first half of the bottle on this side and then burp, and then do the second half of it on this side. And the reason for that is because we tend to get into a habit of what feels more comfortable for us. Like I know for me, holding my baby in my right hand and feeding with the bottle with my left is a little bit less comfortable. And so we get into that habit, but babies are going to be looking at us, right? And so it's good for their vision development to be looking in both directions. So I generally recommend switching sides halfway through so that they're able to get that both directions. Stimulation. So that is paced bottle feeding. I hope that is helpful, and if you have any questions about feeding your baby from your body or your breast or the bottle, you are more than welcome to reach out to me. If you're in Ontario, I'm available virtually and in person, and visits can be covered under naturopathic benefits. If you are not in Ontario, your local lactation consultant also has lots of information about bottle feeding your baby, so feel free to reach out to someone who is local to you. All right, everyone, have a good day.